And the Health Minister, Dr. Motsoaledi, now joins us on the line. Dr. Motsoaledi, thank you so much for your time this evening, Minister. Really do appreciate it. Some of the findings in the report are gross neglect of psychiatric patients, vital signs were not monitored regularly, record keeping was poor, and there were no written treatment protocols that existed. And as a result of that, 2 patients had died. The problem sounds a lot more systematic than negligent in this instance. Tell us how your conversation unfolded today with some of those senior health officials, specifically around some of the findings in the report.
Good evening, Oliver. Good evening to the listeners and viewers. Look, remember that the Health Ombudsman has got recommendations which must be implemented. The first thing is that a task team must be formed in order to supervise and monitor the implementation. Now, some of the issues are such that some of the managers are going to be charged or appear before DC or be reported to the health professions councils and nursing councils. So I can't meet the people implicated in that way. What I was going to do in the Northern Cape was to meet with the Department of Health and the Premier of the province and the management of the department to show them the weaknesses and draw the strategies to deal with the general weaknesses. But also to meet the unions, the various labor unions, and inform them about what has happened and what steps we are going to take. So some of the implementations might not be urgent because the labor unions lodged a complaint that they believe that some of their members were fingered wrongly, or it's unfair that they got fingers. It's a problem of management, not them, etc. So I had to brief them, Oliver, that in the Act, while the Health Ombudsman has released a report, if you are not happy, you appeal, the minister is then obliged to set a tribunal that must consist of 3 people, a retired judge or a retired magistrate, a psychiatrist, or a senior, a prominent community member, or a prominent person who has got an understanding of medical issues. And that tribunal of 3 people, as I said, to be chaired by a retired judge or retired magistrate, must then review the Health Ombudsman. Where they believe the whole Ombudsman did something wrong, then they can reverse that. Then it's then that we can implement. But if nobody lodges a complaint, we'll go on with the implementation.
Yeah.
But I can't yet meet a person who has been fingered. For instance, a doctor who did certain things that are wrong medically. I can't meet them because they are still going to appear in front of their respective professional bodies.
Just on that point, Minister, one of the labor unions, DENOSA, for instance, they say blaming the medical staff is scapegoating, given that the problem is a lot more systematic. The buck must stop, they say, in this instance with the acting HOD as well as the MEC of Health, because that's where the failure comes from, not the medical staff on the ground. What's your take on that?
No, Oliver, the Ombudsman cannot scapegoat, because he's not responsible for doing this work. A person who scapegoats is the one who was supposed to do a job, failed to do it, and hide behind something. That's how I understand scapegoating. The Ombudsman can't scapegoat. He's just putting findings there, which, if they are challenged, then I told you the procedure that must be followed. Obviously, if you belong to a union and your member is fingered, you have got to stand up and defend them or protect them. I have never met a union that said, our member must be punished. They always protest. And that's why in the Ombudsman Act it says, in case you are not happy about the findings of the Ombudsman, you can't just ignore them. They need to be a tribunal. And that tribunal, and you can't go to the Ombudsman and challenge him and say, this is wrong, because he can no longer do anything about it. That tribunal is the one that is legally empowered to deal with the matter. And that's exactly the procedure that's going to be followed.
Yeah.
So
Minister,
I can't.
Just a last question and a very brief answer, hopefully. You had the meeting with the Premier as well as the MEC. You had the meeting with the Premier and the MEC today. What is within your statutory powers about what you could potentially do about this, both from a retrospective accountability perspective, but also ensure that these sort of things don't happen again?
I'm sorry, there was interference.
Yeah.
There was a double voice. I don't know where it came from.
Okay, just very briefly.
I didn't hear your question very well.
Just very briefly, Minister, what powers do you have to do anything about this, both from holding people accountable, but also ensuring that this doesn't happen again?
You know, Oliver, this, as you understand, health is a concurrent competence. It's concurrent, which means it has got a national and a provincial element to it. We're doing it together. At the national level, all we do are norms and standards usually. But most of the problem are HR issues, which are purely provincial. The hiring of staff, the management of staff, the dismissal of staff, taking them to DC are all provincial functions. All I can do is to advise on certain issues. I can't impose, for instance, and I cannot put anybody under what you call DC. The main job that the UMPAT recommended to me is that I need to conduct a forensic audit into the procurement functions. That work usually falls in the provinces, especially in the Premier's office. But the reason that he chose me is specifically because the province cannot investigate itself. And so he specifically is giving me that job. But beyond that, most of the things he have put there are provincial functions.
Yeah. Minister, thank you so much for your time. Really do appreciate it. That is the Minister of Health, Dr. Motsoaledi.